Welcome to the Infant Safe Sleep Ambassador Training, and thank you for your commitment to your community. This is a very important topic that we will be discussing today, and we appreciate your willingness to spread this life-saving information to parents in your communities. Some of the information that you will come across today may come as a surprise to you. Some of you may have questions about it. We want you to feel free to ask any and all questions. An email is provided at the end of the presentation for this purpose. Lastly, the information that we will present to you today has been gathered and compiled from sources such as the U.S. Department of Health and Human Services, the National Institute of Children's Health Quality, and the American Academy of Pediatrics. This training has been adapted from the Cribs for Kids training on infant safe sleep. We aim to provide you with the leading information, statistics, and practices that have been researched and endorsed by experts in the field of pediatrics and infant safety. Here is an outline for the training. We will first begin with an introduction into infant safe sleep. Then, we will go through 5 steps that are involved in setting up a safe sleep environment. Each step is followed by a scenario. There are 2 additional scenarios at the end of the training. An email for questions is provided at the end of the training. Let's get started. We are here today to talk about the best and most supported ways to lower an infant's chance of death by SUID and SIDS. SUID, sudden and unexpected infant death, is an umbrella term that includes the condition known as SIDS, sudden infant death syndrome. Both are tragic as they involve the sudden death of an infant that oftentimes is unexplainable through autopsy. SUID cases can often be linked to suffocation, asphyxia, entrapment, infection, ingestions, metabolic diseases, or trauma, unintentional or non-accidental. In the U.S., 3,600 babies a year die from SUID. This number was higher in the 1990s before the institution of several safe sleep programs, such as the American Academy of Pediatrics Safe Sleep Recommendations in 1992, the Back to Sleep campaign in 1994, and the Sudden Infant Death Investigations Reporting's release in 1996. Although this is an improvement, we can do better. Infant sleep-related deaths are the leading cause of death in infants between 1 month and 1 year of life. This is most evident between 1 to 4 months of life. So many of these deaths can be prevented by implementing safe sleep practices every time a baby sleeps. In Illinois, Cook County, recent statistics revealed that 116 babies died from a sleep-related death between 2015 and 2016. In these deaths, it was discovered that 72% had at least one sleeping risk factor present. We want you to look at this statistic and think of it as 72% of these deaths were preventable. Your role as a sleep ambassador is to commit to educate parents in your community about infant safe sleep and actively work with parents to provide them with the necessary resources and support to reduce the risk of sleep-related deaths. We will now walk through 5 setup steps which ensure safe sleep. At the end of each step, there will be a scenario in which you will be asked to correct the sleeping environment to be safer for an infant. Let's get started. Step 1. Set up baby. First and foremost, we would like to emphasize the importance of lying a baby on its back. Babies who sleep on their back are the safest babies, and here are a few of the reasons why. Lying on a child's back keeps its airway open. It also reduces the risk of choking, and it prevents rebreathing. It is often believed that by lying a child on its back, he or she is at greater risk of choking. I would like you to take a look at this picture. Notice that in the picture on the left, the trachea, which is the baby's airway, is above the esophagus, a tube that brings food from the mouth to the stomach. Now take a look at the picture on the right. While lying on his or her stomach, the trachea is now below the esophagus. This is problematic because the food now has a greater risk of falling into the trachea instead of moving down to the stomach like it should. When babies are laid on their back, there is no increase in risk of aspiration or vomiting. Be sure to remind parents that coughing is okay. Coughing does not indicate choking. It can just indicate that a baby is clearing his or her airway. It is a normal reflex in babies, just as in adults. In addition to keeping a clear airway for the baby, lying the baby on his or her back prevents rebreathing, where a baby breathes in the same air that they just breathed out. Expired air is higher in carbon dioxide, and rebreathing that air decreases the amount of oxygen that a baby receives. This puts them at risk for asphyxiation. Babies should be dressed properly before bedtime to avoid overheating. This means using lightweight sleep clothing such as a sleep sack or a wearable blanket. The room should be at a comfortable temperature for adults. The American Academy of Pediatrics does not recommend that babies be tucked in with blankets. Although they may be tight at first, blankets can become loose and are at risk of covering a baby's face and causing suffocation. Babies can be swaddled, but the material should be lightweight and should be kept away from the infant's head. Swaddling can be used to soothe a fussy baby. It has not been associated with a reduced risk of SUID, so it is not essential to teach parents to swaddle their child. If parents feel the need to swaddle, make sure that they are doing so correctly by not covering the baby's face, and using a lightweight, breathable fabric so as to avoid overheating. When babies are swaddled, they should be laid down on their back. Prone and side swaddling increases the risk of SUID. Lastly, swaddling should be discontinued when the baby starts to try to roll over. If an infant is fussy at bedtime, he or she may be given a clean, dry pacifier to soothe them. Pacifier use during sleep is protective against SUID, and therefore should be considered especially with fussy babies. Babies should be already breastfeeding if they are to be offered a pacifier. A concern that parents may have is that lying a child on his or her back will cause flat spots on the back of their head. If flat spots do develop, they are readily lost with consistent tummy time, while the baby is awake and being supervised by an adult, and will eventually disappear over time. Babies should always sleep on their stomachs. However, once a baby can roll over well, which means on their own and without assistance of nearby objects, parents do not have to reposition the baby if he or she turns over while asleep. Scenario 1. A father you are talking to says he feels that he cannot lay his son on his back because he always coughs in that position. How do you respond? You inform him that coughing is normal for infants and that it helps his son keep his airway clear in the night. You also inform him that infants are safest when they sleep on their back. Step 2. Set up the crib. The crib should be set up with a firm, safety-approved sleep surface. Surfaces that are too soft and may sink and conform to the baby can be dangerous. Babies should not be put to bed on pillows, quilts, or other soft surfaces. Babies who sleep on their stomachs and on soft bedding increase their risk of sleep-related deaths by 21 times. Inside the crib, There should not be loose bedding, stuffed animals, toys, or anything that a baby can grab. These can be dangerous and can lead to suffocation. Cribs should not be equipped with bumper pads, as the standard crib slats are safely positioned. If there are any questions about which crib slats are safe, use a soda can and try to push it through the crib slats. A safe crib does not have enough room for a soda can to fit through. Here is a visualization of the soda can test. The first picture shows how dangerous bumper pads can be for infants. The second shows an example of a Safe Sleep approved crib with slats that are appropriately distanced so that a soda can cannot fit through. The last picture on the right is a crib that would fail the soda can test. This crib can be dangerous for infants. A good rule of thumb is to decorate the room and not the crib. The crib essentially should be a comfortable box where an infant can sleep. All other decorations and toys should be placed outside of the crib and outside of the infant's reach to ensure a safe sleep environment. Scenario 2. A mother sends you a picture of the crib she spent the last day decorating. What is not Safe Sleep approved in this picture? There are 3 things in this picture that are not Safe Sleep approved. The rib slats are a safe distance so the crib does not need bumper pads. The surface is too soft and not Safe Sleep appropriate. There should be no toys in the crib with the baby. Step 3. Set up the room. There are certain steps that can be taken to ensure that the room an infant sleeps in promotes safe sleep. First and foremost, it is essential to remind parents that infants should not share a bed with parents or siblings. Bed sharing increases a baby's risk of sleep-related death by 10 times. There is a risk that, while asleep, an additional bed inhabitant can roll over onto the infant and suffocate him or her while asleep. A sad and scary fact is that half of the infants in the United States who died from sleep-related deaths were found sleeping in bed with their parents. Many activities such as breastfeeding or soothing a baby are done while a parent sits on or lies in bed. Care should be taken while in bed with baby that parents do not fall asleep. Alarms can be set to encourage the adult to wake up and place the baby in the crib. Another location parents should be cautious of is couches. Couches are especially dangerous as babies can get stuck in between cushions and suffocate. Upholstered chairs are a similar threat. They are soft, and if a parent falls asleep with the baby in the chair, the baby can roll off and get stuck between the arm and the cushions and suffocate. A baby's sleep area should be close to but separate from where others sleep. Ideally, a crib should be located away from windows and against an interior wall. If possible, it is encouraged to keep the crib close to the bed so it can be easily reached during the night. This ensures closeness of mom to the baby without the baby being in bed with mom. Baby monitors can be helpful in general, but they should not replace safe sleep practices. Make sure parents set up the room and ensure a safe sleep environment first and foremost, and continuously remind them, especially with the newborn, that babies are safest when they sleep in an adjacent crib and not in a bed. Scenario 3. You have a mother who tells you that she plans on having her baby sleep with her because cribs are expensive, and she would rather her baby be close to her for better bonding. What should you tell her? You should inform her that infants who share a bed with parents or siblings are at the highest risk for a sleep-related death. You can reassure her that programs such as Cribs for Kids work to provide cribs to mothers who cannot afford one. It would also be good to reassure her that there will be plenty of opportunities for her to bond with her baby. Step 4. Set up parents. There are things that parents can do as well to ensure that they promote a safe sleep environment for their child. Just as smoking is prohibited during pregnancy, it is also discouraged after the birth. Exposure to passive smoking in the house doubles a baby's risk of SUID. Parents should be discouraged from smoking around the child and should not allow others to smoke around their baby as well. Smoking is very dangerous and releases many toxic chemicals into the air that are especially harmful to an infant. These chemicals can adhere to soft surfaces, such as couches and clothing, and can be inhaled by the infant from them. If a parent must smoke, it should be done far away from a child. The parent should also change his or her clothing before handling the baby. Breastfeeding should be encouraged in new mothers as well. Breastfeeding not only provides many health benefits to an infant, but infants who are breastfed have 50% reduced risk of SUID. If a mother cannot breastfeed, infants should receive expressed milk for 6 months. Breast milk is equipped with maternal antibodies which help fight infections, as well as various healthy proteins and micronutrients that boost an infant's young immune system. Breastfeeding decreases the risk of infections for a baby, which in turn makes them less vulnerable to SUID. Parents should also commit to regularly supervised tummy time. Tummy time does not have to be done on the floor. It could be done while holding a baby as well. Just be sure that parents supervise their child during tummy time and try to incorporate it into their daily routine. Tummy time has many benefits, such as strengthening neck muscles, preventing flathead syndrome, and encouraging cognitive development. Here's a graphic depicting a few of the benefits of tummy time on growth and development in infants. Parents can also promote a safe sleep environment by being mindful shoppers. Tell parents to refrain from buying and using products that are marketed as sleepers, nappers, and positioners, as they can be dangerous in a baby's crib. Please inform parents to consult safe sleep websites to evaluate products before purchasing. Parents should be informed that they should refrain from allowing their child to sleep in a car seat or a swing if there is an appropriate sleep environment available. An infant slouching posture in one of these seats can cut off an airway and be dangerous. If possible, it is best to allow the infant to fall asleep in the swing or car seat and move them to a safe crib when possible. However, in a moving car, it is okay to keep the child in the car seat, as that is the safest location for them at the moment. Scenario 4. A couple takes a lot of road trips to visit family members and wants to know if it is safe for their infant to sleep in her car seat. What do you tell them? You inform the parents that the car seat is not the safest sleep environment for a baby. However, during a road trip, that is the safest place for an infant to be, so it is okay to let the baby sleep in her car seat while on a road trip. Step 5. Setting up beyond the house. Babies do not remain at home for the entirety of infancy. The reality is that many babies will visit and be cared for by grandparents and close family friends. Parents should do their best to inform grandparents, siblings, babysitters, and others who may care for the infant of proper safe sleep practices. About 1 in 5 SUID deaths occur while a baby is in care of somebody else. Some of the more risky situations a baby can be in concerns an infant who is used to sleeping on their back and who is then placed on their stomach by a caretaker. This is called unaccustomed tummy time, and babies in this position have an 18-times increased risk of sleep-related death. Encourage parents to normalize the topic of safe sleep with family members to ensure that safe sleep practices are followed by all who come into contact with their child. Consistency is key for maintaining safe sleep. Scenario 5. A father tells you that his mother often comes and cares for the baby when he and his partner are at work. What should you remind the father of? You should remind the father that consistency is important for safe sleep. Remind him to inform his mother and others who care for the baby to follow the safe sleep practices that he and his partner adhere to. If a parent has a fussy baby, encourage them to use the 5 S's to soothe a fussy baby. Swaddling, side or stomach position until the baby is asleep, shushing, swings, and sucking on a pacifier. Sometimes a soothing infant massage or a bath can quiet a baby and encourage sleep as well. Practice scenario 1. Identify why this is an unsafe sleeping environment. The infant is loosely wrapped in the blanket. Infants should be swaddled tightly so that the blanket cannot cause asphyxiation in the night. There should be no stuffed animals in the crib. Lastly, the surface is a loose-fitting blanket. Crib surfaces should be firm and fitted with a tight-fitting cover. Practice scenario 2. A mother calls you to ask for advice. Her son has started to roll over on his own, and she remembers you telling her something that changes with sleep when a baby starts to roll over. What is it? You remind the mom that she should continue to lie her son down to sleep on his back. You also tell her that once babies start to roll over on their own, it is okay to leave them on their stomach should they roll over in the middle of the night. Normalizing and keeping an open conversation about safe sleep helps many in the community to be introduced to the concepts of safe sleep practices. Here are testaments from past safe sleep ambassadors that speak to this. It sparks great conversation with parents and serves as a great method to reinforce being mindful of the little things that could become big issues. I enjoyed connecting with and helping different people in my community. Sharing the sleep and safety information was beneficial and rewarding. Young parents and first-time parents were excited to receive safe sleep bags and learn new information. As a Safe Sleep Ambassador, we would like you to identify new parents or parents with a young infant in your community. Using this presentation and resources linked at the end of this presentation, talk to them about safe sleep, providing information in a gentle and non-judgmental manner. Do your best to answer their questions. There may be questions that you do not know the answer to or are unsure of. That is okay. Please do not hesitate to reach out to us for help answering these questions. You may then give the parents a safe sleep kit. Please go over each item in the kit so that the parents know how to properly use them. Parents should be encouraged to talk to others and join parenting groups to keep the conversation rolling as well. Here is a page of resources for more information on safe sleep practices that you may use for your own education or for educating parents. Thank you for your attention. Please do not hesitate to reach out with any questions.